Thank you. Good morning. And it's good to be with you today. This for me is very fun because I am a political hack and a policy guy. And it isn't often that I get to spend a day diving into the science behind the policy work that I do at the American Heart Association, that our team does at the American Heart Association. So I'm glad to be with you. This is also, for me, a little bit of a high wire act because I've been asked to talk about the Heart Association's standard for added sugar. And I'm going to just give you a brief description of our standards for adults and then kids. But Miriam Voss is here, and she led the writing on the paper for pediatrics. And so I'm going to defer most questions to Miriam, if that's okay with you, as she was the real expert, and I'm reading notes provided for me by others. But happy to be with you here today. And thanks to Kaiser for their work in organizing this, and to UCLA as well, and the team here. So as we think about the adult recommendations for added sugars that the American Heart Association has adopted.
Excuse me,
yeah.
Can you hit the next slide?
Oh, sure. There we go. As we think about the adult recommendations for added sugars, it's 6 teaspoons or 100 calories for women and 9 teaspoons or 150 calories for men. The writing group that developed this recommendation used the discretionary calorie concept. They took the average number of calories needed for most American women and men, looked at the discretionary calorie allotment in the USDA meal plans, and took half of the discretionary calories for added sugars. Now, there was some criticism that they were too strict, but in fact, the writing group felt generous since the discretionary calories were designed to include all calories from added sugars, solid fats, and alcohol. On the pediatric recommendation, our writing group selected an amount that falls within the WHO recommended guidelines, which you see on the screen, of less than 5% of calories for most children. They thought that is easy to remember. They debated tailoring the amount across the range of ages and sizes, but felt that it was impractical and less useful to do so. If one looks at average caloric intake in the U.S. In children, 5% of calories in grams of sugar would range from 18 grams a day for 3-year-olds to 28 grams a day for a 16-year-old. That's a range of 4.5 to 7 teaspoons, making 6 teaspoons a reasonable target for most children. So our recommendations for children were based on the amount of added sugar that falls within the recommended less than 10% of calories, and factors in some level of activity as well. The 100 calories is a recommendation. Children and teens who are very active may have a bit more room in their diets for a little more sugar, and those children who are sedentary would have less. I think one note that these recommendations are not based on a dose response. I think the committee and our nutrition committee as well at AHA feel like there's a major gap in the literature around what an appropriate dose response would be, but they're worried that it would be hard to get a dose response study through an institutional review board. And are not necessarily sure how you would get that done. You might be able to do it on a really short-term basis, but it'd be hard to do something longer term. But as we continue to think at AHA about added sugars and the appropriate amount of consumption of added sugars, we see that as a major gap in our understanding of the science.